So what are the benefits of an HRA? It provides flexibility. There are hundreds of eligible expenses for your HRA funds, including prescriptions, most over-the-counter medications, doctor office copays, health insurance deductibles, and co-insurance. HRA funds may be used for eligible expenses for your spouse or federal tax dependents. You can see a list of eligible expenses for more detail on our website, which is just ASIFlex.com. It's easy to access. The funds in the account are easily accessed with a payment card that you will automatically receive. Your account balance is then available anytime online. So you can submit a claim through your online account detail through the mobile app. There are rapid reimbursements. You can use it to pay for healthcare expenses. It's easy to use your payment card. If you do not want to use the payment card, you can quickly and easily create your claim via the mobile app or online. Once you submit receipts, you'll be reimbursed via check, or you can sign up for direct deposit. The reimbursement time frame is about 24 to 48 hours. So if you sign up for direct deposit, the turnaround time for reimbursement is fairly quickly. Out-of-pocket costs are covered. You are responsible for any portion of your health care that is not covered by your medical, dental, or vision plans, including deductibles, copays, co-insurance, and other unreimbursed amounts. The HRA can be used to cover all of these costs. The tax advantages: the contributions are not taxable to you, and the distributions are not taxable as long as they are spent on eligible healthcare expenses. With a defined contribution in the HRA, funds are deposited while you are still actively working, growing over time, and becoming available for you to use while still employed or upon retirement or separation of services. Participants are 100% invested immediately, meaning that you own the account balance as soon as it is established. So once it is established, that full $1,500, including any rollover funds from the prior year, are all completely eligible for you to use. The account balances automatically roll over year to year for qualified expenses. The reimbursements are tax-free, and the funds can be used to reimburse eligible medical expenses incurred by you, your spouse, or any of your qualifying dependents. The defined contribution for the HRA provides an opportunity to bridge the gap between retirement and Medicare eligibility. So now let's move into what are FSAs. The FSA is a flexible spending account, which is a year-to-year account where you yourself would set aside those pre-tax dollars to pay for current year expected expenses. You may enroll in any health insurance plan. There are two types of accounts. There is the general purpose healthcare FSA, which include deductibles, copays, office visits, medical, dental, and vision. And then there is the dependent care FSA, which is for daycare services. So it's for daycare, after school care, preschool, and nursery school while you work. So what are the benefits of an FSA? It's pre-tax contributions, which lower your taxable income, and reimbursements are made tax-free from the employee's account. In addition, the employee has access to the entire elected amount first day of the plan year. There are two types of ways to pay for the healthcare. You can use your payment card, which will automatically be sent to you. You provide the card to a qualified merchant or healthcare provider, and they will swipe the card like any other credit or debit card to pay for your purchase. The funds will come directly out of your flexible spending account to pay the provider, or you can self-pay and get reimbursed. So you can pay using your own personal credit card, cash, or check, and then keep the itemized receipt as documentation. Then you can log into your account online to file for reimbursement and upload the documentation. You can then receive the funds via check or direct deposit. Tip: if you set up direct deposit online, you'll receive your reimbursements quicker. So how does it work? First, you estimate the expenses that you know you will have during the year for the FSA. You make the pre-tax contributions. You incur eligible expenses. You submit the claim, and then you get reimbursed. This is an example of how the FSA saves you money. So in this example, you have $4,000 in daycare expenses, $2,000 in healthcare expenses. Your annual income is $50,000 for the year. So without an FSA, your taxable income will be that full $50,000 that you make that year. It's estimated that you pay about 30% in taxes. So that would be about $15,000 in taxes that you would pay that year. So now let's look at that with an FSA. So if you have those pre-tax contributions coming out for those known healthcare and daycare expenses, that would reduce your taxable income to $44,000. So that means you would pay less in taxes. You would only end up paying about $13,200. So you end up with $1,800 in extra money due to the reduced taxable income. The FSA is IRS regulated, so you have to re-enroll each year with a new election if you would like to enroll. You must spend all the funds during the year. Expenses must be incurred during your period of coverage or plan year. You do not have to be covered under your employer's health insurance. You can use to pay for expenses for your spouse or any of your tax dependents, regardless of whose insurance they're on. The election will then remain in effect for the plan year unless you experience a qualified status change, which are things such as marriage, death, birth, and divorce. You can access all healthcare funds anytime during the year. So the amount that you elect for the year is all available to you day one of the plan year, even though you have not contributed that amount. The funds are then forfeited at the end of the year, so make sure that you remain conservative with how much you elect until you know exactly how much you're going to spend that year. You are allowed to carry over up to $550 of the healthcare funds within the FSA, the healthcare FSA. So how to avoid forfeitures? It's easy. Plan for predictable and reoccurring expenses you know you will have during the year. Review prior year expenses as a guide. Be conservative, so start out with a small dollar amount by looking at what you spent last year and will be spending again this year. There are several tools online through our website, which is just ASIFlex.com, which include an expense estimator, an eligible expense listing. The FSA store is a great resource for over-the-counter products. It helps to take the guesswork out of which items are eligible. You can also purchase things through the FSA store, but you definitely do not have to. And then remember, you can carry over up to $550 in the healthcare FSA. Go ahead.
We have a couple of questions. I thought this might be a good time to take those. One is there a way to see what amount is from what fund year so we know when the expiration dates are?
Great question. So once you have established your online account detail through ASIFlex, and all you have to do is just go to asiflex.com and click on, I think it's employee login. You can then establish an account detail, which you will set up a username, a password, and a security image. And from that screen, you can log into the plan year, and that will tell you your period of coverage, the claims filing deadline, how much you have available in the account, what you've contributed to date. So basically, it'll provide all of the information that you should need.
Okay. And so I might just add to that, since this year is the first year, and I believe we took over mid-year, what you will see right now is only current 2021 plan year information, I believe.
Yes,
so
that is correct.
As we move into 2022, then certainly you will see separate plan years. So you can choose 2021, you can look at 2022 separately. So you'll see more of that as time goes on. And I think we actually, as we get into the third year, you'll be able to see a full 3 years worth of information. I see a couple of questions that are related to carryover, rollover. One person says, it is my understanding that the funds do not expire from year to year and just roll over.
So that is true for the HRA. So that is the employer funded account where they put in $1,500 each year, and there is no max on that. The full amount will carry forward in that HRA. But if you choose to enroll in the healthcare FSA, which is where you're actively contributing to the plan, there is the $550 carryover.
So in other words, you have two separate plans that you need to look at. This is similar. I think we just answered that. Do we still have to use up all of our FSA before accessing the FSA. I think she means the HRA, or he means the HRA.
Yes, the FSA will pay first if you are actively contributing to that FSA. And then once that is exhausted, so you don't lose anything, it will then automatically begin taking from that HRA.
Okay.
Let me interject for everyone. This is Petralia. That is a change from what we've been told in the past. We were required to use our HRA first. Once it was exhausted, then we would use our FSA. But in order to make sure that we do not lose money towards the end of the year with our FSA, it has been reversed. And the order now is that you use up your FSA, you'll have money from your HRA to use if you like. It will carry over if you have a balance into your retirement if you're, at that point. So just be aware of that. That is a change.
One person just commented the HRA full amount rolls over, but not the FSA. Do you want to just clarify that once again?
Yeah, absolutely. So for the HRA, which is the employer funded account, that full amount will roll over from year to year automatically. There's nothing that you need to do. If you enroll in the healthcare FSA, which is the one that you are actively contributing to, and it's something that you must enroll in, it doesn't happen automatically. That is just a $550 carryover. And then anything above that would be forfeited.
Let's throw this one over to Andy. This person is asking, is the debit card used for FSA the same card that is used for the HRA, or is it a different card?
Yes, with ASIFlex, you'll have one card for both accounts, and both accounts will be loaded if you participate in the FSA and the HRA. You will have two separate purses on your card, and the FSA will still spend down first so that you don't risk losing any money for your FSA. And then the HRA will take over after you've already used up all of your FSA money.
I see a dependent care question, and I think we'll hold that just for a moment. But here is a healthcare related question. If you still had receipts to submit to WageWorks, but don't have any additional funds, where do you submit those receipts? The new company or to WageWorks?
I can go ahead and take that one if you would like. So if you're out of funds for the 2021 plan year, which is the plan year that we're currently in, unfortunately, you just would not be able to submit those because you would be out of funds to get anything reimbursed.
And then just a clarification, a person said she may have missed this, but which gets used first, the FSA or the HRA?
The FSA gets used first.
So flexible spending account. You mentioned separation of service. So if we leave the district, do we still have access to the HRA funds? And do we still use the same debit card?
Yes, once you leave the district, you will still have access to those HRA funds and you will still use those same cards.
So when they separate service, the cards actually continue after they're terminated?
Catralia, correct me if I'm wrong, but I believe they're still able to spend down the funds, correct?
Yes, once they are in retirement, say for instance, and or age 65, that card will no longer be renewed, but the monies on their initial card will be still eligible to be used if they have anything left by that time.
Okay.
Thank you.
Does the HRA carry the balance through retirement?
Yes.
If they're early retirees before the age of 65.
So Katie, I'll turn it back to you.
Thank you. Okay, so now let's go a little bit further into the healthcare FSA. So the general purpose healthcare FSA, the minimum that you can enroll for the year is $300, and that's for the year. The maximum is $2,750. So some eligible expenses for the healthcare FSA include prescriptions, office visit copays, deductibles, x-rays and lab, hospital, mileage to and from healthcare providers, over-the-counter items such as Band-Aids, sunscreen, braces, first aid supplies, pill holders, blood pressure monitors, thermometers, diabetic supplies, menstrual care, drugs and medicines, as well as personal protective equipment, including face masks, hand sanitizers, or COVID-19 and in-home testing kits, vision exams, eyeglasses, prescription sunglasses, contact lenses and solutions, reading glasses, LASIK eye surgery, dental exams, x-rays, fillings, orthodontia, crowns, bridges, dentures and adhesives, and implants, as well as hearing exams, hearing aids, and batteries. So this is a list of over-the-counter eligible expenses. So medicated over-the-counter items used to require a prescription, but that went away January 1st of 2020. So things such as pain relievers, allergy medication, cold medication, eye drops, oral pain relievers, menstrual care products, those are now all completely eligible without needing anything else. I mentioned it earlier, but a good online resource tool is the FSAstore.com. You can actually purchase items through the FSA store, which I'll talk about a little bit later, but it's a great tool to tell you which items are completely eligible without requiring anything else. The plan year's election is available anytime. So for the calendar year plan year, if you contribute $100 per month, that would be $1,200 for the year. Let's say on March 15th, you incur a $500 expense. Your year-to-date contributions at that point is just $300, but the plan will still pay that full $500 expense, even though you have only contributed $300. So the full amount is available to you day one of the plan year, regardless of how much you have contributed. So these are some examples of ineligible expenses. So expenses that are not eligible for the healthcare FSA. So they are services not provided yet, including pre-treatment estimates, cosmetic treatments or medications, general health and well-being, illegal operations, expenses paid by insurance, diapers and maternity clothes, insurance premiums, dancing and swimming lessons, natural remedies and vitamins, as well as warranties. These are all ineligible, so not eligible for the healthcare FSA. So this is a sample planning worksheet to break down how much you know you will be spending within the year to know how much to sign up for. So let's break down all of your known copay amounts, any known office visit copays that you know you will have. If you know that you will have some dental work or that you will need to get glasses, as well as any mileage. And then you just total out that total dollar amount, and then that is how much you should set aside for the year. Okay, Anita, do you want to go to the chat?
Yeah, just a quick one here that I noticed. What happens if someone separates from the district without retiring? Does the HRA-FSA still work?
For the FSA, your coverage would then end
At the end of the month.
at the end of the month. Thank you, Andy. So yes, if you separate, your coverage will then end at the end of the calendar month following the end of that employment. So you will only be covered up until that point, until the end of the month after that coverage date ends.
And that was for the FSA?
Yes.
Just a short question about vitamins, if those are eligible. Connie, do you want to take that one? Or Andy, whoever's available.
Yes, there are a couple of vitamins that are eligible. Sorry, Connie. Including prenatal vitamins and glucosamine. And you can see that through the FSA store, which vitamins are eligible. If you have to take vitamins for a specific medical condition that are not prenatal vitamins or glucosamine, then you will need to get a letter of medical necessity from your physician stating the specific medical condition for which you take those vitamins and that they are required for treating that condition. And if you have that letter from your doctor stating that they're medically necessary for your condition, then we'll keep that on file for an entire year, and you're able to submit reimbursement for those vitamins for that year.
Thank you. We do have a few questions about eligible expenses, and just in the essence of time, I might recommend to each of you on ASIFlex.com, we have an extensive listing of eligible expenses. So certainly you can take a peek there. But at this point, I think we'll go ahead and move on into dependent care.
So the minimum for dependent care for the year is $300. The maximum is $5,000, and that is a household maximum. So if both you and your spouse, let's say, are employed with LA Community College, you can both do $2,500 or any combination. You cannot go over that $5,000 household maximum. It is $2,500 as well if you are married and filing separate income tax returns. So the dependent care, this is for expenses while you are working. So for babysitting while you work, preschool or nursery school for young children, before school or after school care, day camps, and these are all for children under the age of 13. And then for children 13 and above who are not capable of self-care. So the dependent care is a bit different where it only pays up to the cash balance. So for example, for the calendar year, if you are contributing $300 per month, that would be $3,600 for the year. On January 31st, you incur a $500 expense. Your year-to-date contributions at that point is just the $300 contribution. So the plan would only pay out that $300 in contributions. The difference of $200 will just go into a pending status until your next contribution is made. And then that difference will automatically pay out to you. So some ineligible dependent care expenses are for services not yet provided. So an example of that is summer day camps. A lot of time you have to prepay to hold the spot, but unfortunately you would not be able to submit that for reimbursement until after those services have happened. Educational or tuition expenses, which are kindergarten or higher education, overnight camp expenses, services provided while you are on vacation, holidays, or leave of absence, because you have to actively be working in order to submit those expenses. Divorce situations, only eligible expenses incurred by a custodial parent are eligible. Expenses in excess of $5,000 per family per calendar year. So this is a sample planning worksheet for the dependent care. So you could break down each month that you know you will have after school care, if you will be sending your child to a summer day camp, as well as if the child is going to your grandparents or family while you're going on vacation. And that can help you total out the total amount for the year for dependent care.
Hey, Katie, just a quick question, or for any of the panelists. We have a question here from an individual asking about a dependent care claim was denied for Zoom after school class in the home. She said this was very helpful to her because she's able to sit in another room and grade papers. So wanting to know why that was denied.
Andy, do you want to maybe take that one?
And yes, this comes down to IRS guidelines. Unfortunately, since there isn't direct physical care being provided for the child who is on the Zoom after school meeting, they don't consider it eligible qualifying dependent care. So we just have to abide by those IRS guidelines for what is considered qualifying daycare.
Thank you. Hey, I might just mention this. We have a nice comment here. This person said she has called ASI twice, and both times she was helped and her questions were answered very quickly by the rep. She was very satisfied. So thank you for that. Turn it back to you, Katie.
Okay, so now let's go into some claim filing options. So the IRS requires that you certify that the expenses are eligible and that you have not been reimbursed and will not seek reimbursement under any other source. You must provide third-party documentation to substantiate details about the expenses that you have incurred. A claim form is required for manual submissions that are sent by mail or fax. And then a claim form is not required if you file the claim online or through the mobile app, nor for the debit card. So there are multiple claim filing options. You can file the claim online through your account detail once you have established your username, password, and security image. You will just make sure that the documentation is scanned in beforehand. And again, no claim form is required. You will just submit it online through your account detail with that supporting documentation. You can file the claim through the mobile app, which is really nice because you can just snap a picture of the documentation and submit it that way. So as you're in the pharmacy and you have that receipt, you can just go ahead and snap a picture of it, submit it to us, and we will reimburse you. If you were enrolled in the HRA or the healthcare FSA, you will automatically be sent debit cards, which will go into further detail in a bit. Or you can choose to fax or mail the claim to us, which will require a claim form, which can be found on our website, which again is just asiflex.com. So the ASIFlex mobile app, it's free. There is a video tutorial on our website, which is just asiflex.com. You can use a smartphone or tablet. You can simply just snap a picture of the documentation and submit right from the pharmacy, doctor's office, dental, or vision office. You can check your account balance 24/7. So how to download the ASIFlex self-service mobile app? You can go to Google Play or the App Store, and you can just search for ASIFlex service app and just look for that ASIFlex logo. And then you click the download button to install the app. Please note that you must have your login credentials established before signing into the mobile app. So that means that you have established your username, security image, and password prior to trying to sign into the mobile app. So this is an example of our mobile app where you enter in the username. You can view your online account detail, file a new claim, look at any unfinished claims. You can view the secure message center for any messages that were sent to you, or you can shop directly at the FSA store, which I will get into a little bit later. And this is another example of the mobile app where it shows your account, your annual election, your available funds, what you've contributed to date, the claims that you've made, and the payments that you've received. The second screenshot is the first screen on filing a claim. So the ASIFlex account detail, this is the screen to where you will create an account. Once you have that, then you will just need to input your username, password, and then select your security image. You can register to view your online account statement, read secure messages, as well as submit claims. So how to register your online account detail. First, you'll just go to asiflex.com and click on Employee Login tab. You'll click Create an Account and follow the instructions. So it'll just have you enter in your name, city, state, and then click Continue. And then it will have you enter in your social security number. And then you can establish your username, password, and choose a security image. It'll also have you establish security questions and answers in case you ever forget any of those items. Through your account detail, you can establish your email or text for us to notify you that way, as well as manage your banking information if you would like to sign up for direct deposit. But you can change those at any point in time, all through your account detail. So now let's go into the ASIFlex debit card. So what is it? It is a health benefit card. The IRS regulates the use of the cards. It allows you to pay directly from your health FSA and or HRA account. You can sign the credit transaction, enter the PIN for the debit transaction. It's accepted at healthcare and retail providers that provide Visa. It's not accepted at providers not recognized as healthcare providers and merchants. And it's important to know that use of the card is not paperless. So how does it work? At the point of sale, you'll present the card for payment. The advantage is that you don't have to pay for cash or use a credit card. It's just an easy way to pay. The merchant will process the transaction. The card company reports to ASIFlex, the provider, the date of the transaction, and the dollar amount. So you may need to provide additional documentation showing the patient name, the date of service, and then the type of service and product so we can ensure it's for an eligible expense. So how do I use the card? It's easy. You swipe, ask, and go. So you present the card for payment, which means you swipe the card. You ask for an itemized statement of service or supply that was provided to you, and then go. But be sure to save the itemized statement in case ASIFlex requests it. So be sure to save all itemized provider merchant receipt, not the credit card receipt. You can also submit the explanation of benefits if we ask for additional documentation. Submit the documentation upon request. It's required by the IRS. Always know what your balance is, because there has to be at least that amount within your FSA, otherwise the card will decline. So let's say you have $20 remaining in your account and you try to use the card for $25, the card will decline. It's only going to use up to the dollar amount that you have in the account. Use the card at healthcare providers. So note, some teaching hospitals may not be recognized as healthcare. They may be recognized as educational, so they may not work there. Be sure to check your messages under your ASIFlex.com account detail and submit your documentation upon request. So how do you provide more information? ASIFlex will notify you if additional information is required. You can submit the additional documentation online, via the mobile app, fax, or mail. The IRS requires documentation for all transactions except if the transaction is for a known copay amount through the employer plan that you were enrolled in, an identified reoccurring expense at the same provider for the same amount each month. So a good example of that is orthodontia. So let's say you pay the orthodontist $100 per month. You'll need to submit that documentation to ASIFlex one time, and then you will be set up as a reoccurring expense. So anytime you use your debit card at that same provider for that same amount, it will then automatically clear. The third is if transactions are at certified merchants who maintain an inventory control system of eligible expenses. So examples are retail stores, drugstores, and pharmacies where they have a behind-the-scenes system in place, which most do, of which items are FSA eligible. So then all other expenses for copays that are not under the employer's plan, or any medical, dental, or vision, all will require additional documentation. So how will ASIFlex notify me if additional documentation is required? So there will be 3 notices that are sent asking for the additional documentation. The first notice is sent approximately 5 days following the transaction, just stating that additional documentation is required. If nothing is submitted, 21 days will go by after the first letter is sent. And then that letter will just state that we still need the documentation and advises that the card may be inactivated if not submitted. Another 21 days goes by after letter 2, and then that is the temporary deactivation notice. So that means the card will no longer work until we receive that additional documentation. So if documentation is not provided, the IRS requires that the card be temporarily deactivated. So to remedy, simply provide the documentation and the card will be activated if it's for an eligible expense. If the documentation is lost or the expense is not eligible, you can simply write a check back to the plan and we'll put the funds back into the account as if you never used the card. Or you can always submit a substitute claim for at least up to that dollar amount that you had used, and we will offset that outstanding card transaction and then reimburse you anything over. Anita, do you want to do some questions or do you want me to keep going?
Just a couple on the card. So one individual asked if her spouse can use her card. She commented that the prior administrator provided 2 cards.
Yes, you will get 2 cards automatically. You don't need to request a second card. You will need to request more cards if you need more than 2, but a second card will automatically be sent in your name, and that can be used by any dependents or your spouse.
And then someone wants to know if they can still use their card at Walmart or Amazon. And I'll go ahead and take this one. You can use the debit card at all kinds of healthcare providers as well as retail providers who have an inventory system in place. And literally there are thousands of providers. We actually have a list of those if you're interested. It's on asiflex.com under the programs tab and then under debit cards. But you can shop at Walmart and Target and CVS pharmacies, most any kind of pharmacy or retail provider that is providing healthcare products, as well as FSA Store, which is a nice segue for Katie to talk more about FSA Store.
Okay, thank you, Anita. All right, so let's get into the FSA Store. I've mentioned this a few times throughout the presentation. The FSA Store is a great tool for you to use, as well as being able to purchase items through them, that takes the guesswork out of which items are eligible for the FSA or the HRA. It has thousands of eligible products. A nice new feature, which is still pretty new to us. We rolled it out about a year ago. It's called the FSA Store Cardless Pay feature. So basically, it's payment to the FSA Store made directly from your ASIFlex account. So how does it work? Basically, you can sign into your ASIFlex account or through the mobile app, and you'll click on the FSA Store link to shop. You will then be taken to the FSA Store where you can purchase the items that you would like to, and then proceed to checkout. And then at checkout, you will just choose the ASIFlex payment option, and then that's it. ASIFlex will pay the FSA Store directly from your HRA or your healthcare FSA, and the products will be shipped directly to you. So you don't have to enter in any credit card or debit card information to purchase. You can just click on the FSA, the ASIFlex payment option. So claim documentation, what must it include? Who, what, where, when, and how much. So who, for whom the service is being provided, what, a description of the service, where, the name and address of the provider providing the service, when, the date the service was provided, regardless of when paid, and how much, the dollar amount that you owe. So if documentation is submitted and one of these items is not there, so for example, the date of service is missing, the claim will then be denied. So it's important to always have these 5 items within that documentation that you submit to us. So what type of documentation is required? So if the expense is covered by insurance, so under medical, dental, or vision, you can submit that insurance payer explanation of benefits or EOB, or you can submit the itemized statement. Please note to be sure that you submit to insurance first. If not covered by insurance, you can submit the itemized statement, which includes those 5 things that I went over on the previous slide. For prescriptions, you can send the pharmacy receipt, the printout from the pharmacy, or the itemized mail order receipt. For over-the-counter healthcare supplies, drugs, and medicines, you can just submit that itemized merchant receipt. Please note that submitting credit card receipts, paid on account, or balance forward statements, as well as canceled checks, are not eligible. So some unacceptable documentation, again, is credit card receipts, balance forward, paid on account statements, previous balance due statements, canceled checks, pre-treatment estimates, services not yet provided, as well as health statements. So this is an example of an explanation of benefits, which have all 5 items that we are needing on the documentation. Here's an example of an itemized statement, and you can see here that it's got all 5 items that we are needing, which include the provider, the date of service, the description of service, the dollar amount that you owe, and then the patient name. So there's all 5 items that we would need. This is a great example of a CVS pharmacy receipt. It actually has an indicator of which items are eligible right on the receipt. A lot of places you will see that they do have an indicator on the actual receipt. And on CVS and Walgreens, they actually total it out for you at the bottom for eligible flexible spending account items that you had purchased. This is an example of what your actual account detail will look like. So you are able to see here that follow-up documentation is required for a certain card swipe. So there is a color legend. So if there is additional documentation that's required for that swipe and the first letter has been sent, it'll light up as a yellow, is that additional documentation is required. If the second notice has gone out requiring additional documentation, it'll then light up as pink, just stating that the card is in danger of being suspended. If it's lit up as red, that means that the card has been suspended due to that outstanding documentation. But here you can see the claims filing deadline will always be listed. Of course, this is from several years ago. What your coverage period is, the status of your debit card, as well as your available funds within your account detail. So this is a nice wallet card that is available on our website, which asiflex.com and then /debit cards, which there is a lot of educational materials on the debit card under that website. But it has all of our contact information, as well as the 5 items that are needed on the documentation. And this is nice to print out and carry with you just so you can make sure that you do get the correct type of documentation from your provider if you use your card there. This is also another piece of educational material that is available on our website that just breaks down everything that I've went over about the debit card, including how the 3 notices work, the 5 items that are needed on documentation, the situations where documentation will not be required. So that's all available on our website. Anita, do you want to maybe go into some more questions?
One individual, this has to be related to debit card documentation. She says, it's been my experience that explanation of benefits from my insurance carrier arrive later than 21 days. So I think, the best advice there is, in the meantime, you can always ask that healthcare provider for an itemized statement that includes all 5 items that Katie spoke about. Or rather than waiting for that to come in the mail, most providers, of course, have their own websites through which you can set up an account, and you can perhaps get that EOB sooner online than by mail.
Yeah, this is Katralia. I've always asked for a super bill from the office. Is that still a good way to go?
I believe those are fine, aren't they?
Yeah, I would say that would probably be the same thing as the itemized statement. So they that should provide the same information.
And then we had an individual ask about the card. So she has the 2 cards, both in her name, and she's asking if her spouse can use one of those. And yes, your spouse can use the card that's in your name. They don't have to have a card that's in their name. And then another individual asked about a dependent who is in a different state. Can they use a card? And yes, they certainly can. I will caution you, especially if it's a college student, just make sure they know they are obligated to ask for an itemized statement each time they swipe that card. Or if they're in a pharmacy purchasing things, they may want to hang on to that receipt just in case. They shouldn't need it for a pharmacy transaction, but you never know. But any other kind of expense, make sure they ask for that documentation. Oh, somebody just commented, wow, sunscreen is eligible. Yes, it is. All kinds of sunscreen, and even lip balms, for example. FSA store has, I will say, oodles of products like that that are eligible. So do take a look at that.
Anita, isn't it the best practice or routine that when you use the card, the app, you open up the app and just take a picture of the receipt or the statement?
Absolutely, yes. So,
okay.
And especially for those college students, that's probably what they are likely to do, and that's much safer. I actually do that as well. I keep an image of everything on my phone. That way I have it, because I, like most people, I lose papers and things. So you can do either or both. I think that's it for now, Katie. If you want to go on.
So be sure to go green. You can sign up for email or text alerts to avoid paper notices and delayed mail. You can have the payment for reimbursement sent directly to your bank to avoid the hassle of paper checks and delayed mail. You can file claims online through the mobile app or online. It's quick, it's easy, and it results in rapid claim payments. You can use the FSA Store cardless pay service directly through your mobile app or through the online account detail. For dependent care, you can have daycare providers sign the claim form so no other documentation is needed. So some online resources. You can access your FSA account detail, review any messages that are sent to you. You can manage your personal settings. There is ASIFlex card information. There is an extensive eligible and ineligible expense listing. You can access the FSA Store, which has thousands of eligible FSA products. There is a list of frequently asked questions. There is an expense estimator and tax savings calculator, which is really nice when you're trying to decide how much to enroll for the next year, or if you want to see how much in tax savings you will have by signing up for this. There are several educational videos as well as IRS forms and publications. Some important dates. So open enrollment begins online through our website on September 27th, and it runs through October 15th. So to enroll, you can either establish your online account detail if you are currently a participant in the HRA, the FSA, or the dependent care. And then there will be just an open enrollment link once you are logged into your account detail during this time frame. Or you can enroll online at that website, which is just https://enroll.asiflex.com. And then the employer code word is just LACCD, and you'll just follow the steps to enroll. Be sure to not wait until the last minute to enroll. Make sure that you get it in time. If you want to change the amount that you have elected, you can do that at any point in time during that time frame, and we will accept the last enrollment that you enter. So it'll just basically wipe out what you had enrolled for before. Yeah.
Katie?
Anita? Yeah.
Just a question. So when I go to enroll online, am I enrolling for the FSA or the HRA or both?
So the HRA, you do not have to enroll for. The county or the LA Community College automatically enrolls you for that. So they will send us a file to let us know that you have the $1,500 going into the account. So what you are going to enroll for is only the healthcare FSA or the dependent care FSA. So if you are having any pre-tax contributions coming out of your paycheck, that is what you will need to enroll for.
Thank you.
Lady, let me interject as well. Someone had a question regarding the amount of the FSA, the maximum. I know it changes every year, but if there's a decision that is made as to how much the district will allow us to elect up to, the amount up to is from $300, and currently it is at $2,750. I'm not sure if they're planning to go up to the latest and the greatest amount allowed by IRS at this time, but currently that is the amount for this plan year. For 2022, that information will be published, I'm sure, shortly for the open enrollment period for the FSA program, which that open enrollment is going to be starting a week after the open enrollment for CalPERS that you've received flyers about. Okay, hope that doesn't confuse you. But the open enrollment to enroll in the HRA, in the FSA or dependent care will not start at the same time as we normally have. Allow you to do so from online. You will have to log in to this site, https enroll asiflex.com, in order to sign up this year. Okay, it will not be on our portal, just so you're aware.
So the claims must be incurred during the plan year. So the plan year that for this open enrollment is for January 1st of 22 through December 31st of 22. Incurred means that you have actually had the service provided or that you have secured the product that gave rise to the expense. So it doesn't matter when you've paid for the expense. What matters is that actual data service on when you went to the doctor or the dentist or purchased those eyeglasses. That is what the date that we will use to apply it to this new plan year. The deadline to then submit claims to ASIFlex is then March 31st of 23. Be sure to not wait until the last minute as you may miss the date. Okay, and here is all of our contact information, including our website, our customer service email address, our customer service phone number, which our business hours are listed there, which is 5 a.m. to 5 p.m. Pacific time, Monday through Friday, 7 a.m. to 11 a.m. on Saturday. And then there is our mailing address.
Katie, you referenced March 23rd of 2023, correct? March
Yes.
31st of 2023. Is that for the open enrollment starting the plan in January of 2022, or is that for those who are currently in the FSA and dependent care program?
So the ones that are currently in the HRA or healthcare FSA or dependent care program, so within 2021, the claims filing deadline for that plan year is March 31st of 22. So you always have 90 days after that plan year has ended to get those claims submitted to us.
Maybe we can do just a couple of questions before we break out. Is dependent care FSA included in the overall FSA? And I'll go ahead and take that. You have an FSA plan. And so within the FSA plan, you have two separate accounts. One is the healthcare flexible spending account, and one is a dependent care flexible spending account. Someone asked about the maximum dependent care amount of $5,000 and if that is per person or if that is per plan, per employer. Andy, do you want to address that?
Yes, the dependent care maximum of $5,000 is actually per household. So if your spouse is also enrolling in the dependent care FSA, you cannot combine to go over $5,000. It's not nearly enough, but that's the limit. The medical FSA, the healthcare FSA, works differently though. The limit of the $2,750 is an individual limit. So if your spouse is also employed with an employer who offers the healthcare FSA, you can both have the maximum that employer offers.
Thank you. And then just one real quick question that I think is important for the group before we break off. I've had three people have asked, how do I designate, how do I tell my pharmacy, how do I tell my provider that the FSA pays first? How do they designate which plan pays first is the question.
You won't have to do that. We will do that for you behind the scenes. So whenever you use your card or you submit a claim to us for reimbursement, it's automatically going to apply to your FSA until that has been exhausted, and then it will start to use your HRA. So there's nothing that you need to do, the provider needs to do. It all happens automatically behind the scenes through ASI.
I think we'll wrap that up for the questions submitted. And if we have missed any one of you, please join us in one of the break rooms and we will be happy to help you.